Imagine a young woman, full of life and embarking on a new chapter, only to have her world turned upside down by a shocking diagnosis. This is the story of Marissa Coreno, a 27-year-old who, despite her youth and seemingly healthy lifestyle, found herself battling breast cancer. In 2021, Marissa's life was on an upward trajectory. She had recently moved out, was dedicated to her fitness, and loved her job at a hospital in Ohio. But one day, a simple discovery, a lump in her armpit, changed everything. Initially, Marissa wasn't overly concerned. At 27, with no family history of cancer, it seemed unlikely. However, her colleagues urged her not to ignore it, and their advice proved crucial. After an ultrasound revealed questionable characteristics, a mammogram, and then a biopsy, the news came. Marissa had stage 2 breast cancer that had spread to her lymph nodes. It was a devastating blow. It was hard to believe that this was now my life, Marissa reflected. Breast cancer is the leading cause of cancer death in U.S. women aged 20 to 49, and the incidence rate is rising faster in this age group than in women over 50. Dr. Mary Gemignani, a renowned physician and director of the Women's Early Onset Cancer Program, noted a shift in her practice. When I started, we saw women in their 40s. Now, we're seeing women in their late 20s and early 30s more commonly. Despite this trend, diagnoses like Marissa's are still rare. The American Cancer Society estimates that only about 1 in 1,344 women in their 20s will develop breast cancer. Younger women often lack regular screenings, as mammograms are typically recommended from age 40 onwards. They also tend to have more aggressive tumors or rarer disease subtypes, and the reasons for this increase are not yet fully understood. For young women like Marissa, the journey is unique. They face specific challenges, including fertility concerns, which require personalized treatment plans. Marissa found limited research specific to her age group, but she worked closely with Dr. Baidehi Maiti, a medical oncologist at the Cleveland Clinic, to navigate her options. Being so young and with limited research, I chose the most aggressive options available. I was very protective of myself, Marissa explained. Marissa's treatment was intense. She underwent 4 months of exhausting chemotherapy to stop the cancer spread. Her parents were a constant support, with her mom moving in to help and her dad driving her to every appointment. The side effects were harsh. She lost her hair and struggled with the energy to leave the house. Going from an active, proud life to barely having the energy to get off the couch was a tough transition, Marissa shared. But amidst the challenges, a ray of light emerged. One night, while indulging in some crumble cookies to ease her feelings, Marissa received a message from an old classmate, Anthony, who had seen her Instagram post. Their conversation blossomed, and soon they were dating. Despite her self-consciousness about her wig, Marissa enjoyed their time together, and Anthony's acceptance was a welcome relief. After chemotherapy, Marissa underwent a double mastectomy, followed by reconstruction surgery and radiation therapy. She started hormone therapy in March 2022, which she will continue until 2032. The treatment induces menopause, stopping her body from producing estrogen to reduce the cancer's chance of returning. Today, Marissa is cancer-free, and Dr. Maiti praises her resilience. She hasn't let cancer define her. She's thriving as a survivor and living life to the fullest, Dr. Maiti said. The hormone therapy brought its own challenges. Marissa, now 31, grapples with the new normal of menopause, finding it harder to work out and dealing with hot flashes and sleep disturbances. It's been a difficult adjustment, but her relationship with Anthony has grown stronger. They married in August 2024 and honeymooned in Italy. This summer, they celebrated their anniversary in Cancun, Mexico. Marissa's story is a powerful reminder of the importance of listening to our bodies and seeking help when needed. It's easy to think it will never be you, but it can happen. If you're uncertain about any signs, speak up and get checked. There's light at the end of the tunnel, even if it seems like a long one. Life is beautiful, and it's worth fighting for, Marissa encourages. This Breast Cancer Awareness Month, let Marissa's story inspire us to be vigilant and supportive, especially for those facing this disease at a young age.